just make some highlights because we cannot finish discussing this issue today. And then if there are issues that come up later, we can discuss. Now, we'll discuss under the following topic: the introduction, management, and leadership, resources to be managed, the attributes of good leader, leadership theories, developing leadership skills, and conclusion. Well, the physicians play a leading role in the health team traditionally. This is evident by the way we manage our patients. By the time you see the patient, you give instructions on what to do, either to the younger doctors, to the other health personnel that take care of the patient. So generally, physicians take a leading role in the healthcare system. They are considered to be ultimately responsible for the overall outcome of the patient care. And then they have a social responsibility to speak out on health issues. Leadership and management skills are required to ensure the provision of high quality patient care. It's not only the theoretical aspect of the professional knowledge. You need the leadership skill. No matter how knowledgeable you are, if you do not have the knowledge of how to handle the other members of the team and the patient, then there will be deficiency in the management of the patient. And it's a known fact that participation of physicians in leadership is beneficial. There is an association, positive association between doctors in leadership and clinical practice. This has been proven severally. And the clinical quality depends on interprofessional teamwork, and therefore leadership and management skills are needed at all levels. Leadership and management are discussed, they can be used interchangeably, but they are different. The management is how to manage things, to make sure things work. While leadership, it involves vision. You have to motivate people, let's achieve a certain goal. But they are used most of the time interchangeably. But it's worth of note that physicians find themselves in leadership roles through circumstances. In most instances, what is being taught either in medical school or in the postgraduate program, the management and the leadership course is grossly inadequate. It's grossly inadequate. Most of us have attended management course just for exam's sake and others, but that is not really something that is imbibed into the culture of the training. So there is need for us to understand that we need further training, or let it be included in the curriculum while training. It's said that some are born leaders, some achieve positions of leadership, while others have leadership thrust upon them. And something we should also know is that the extent of leadership is like beauty. It is hard to define, but you know it when you see it. When you see good leadership, you know it. But it's very difficult for you to define. Now, as I've said before, the issue of management and leadership, they are used interchangeably. Management and leadership are essential to the success of any enterprise. Management entails coping with complex organization and ensuring that things run well, that everyday problems are dealt with, and that there is steady and continuous performance of the system. You ensure there is electricity, maintenance, other things. The system moves on. That is management. But on the other hand, leadership, it involves vision, motivation, so that you can achieve that vision. It requires dealing with change. This change may be unanticipated. You just be here and then a new disease will come up. You may just be here and new medical technology will come up. So you need good leadership to achieve that. You either stay where you are and continue with the old technique, or you now say, fine, this is doable and let's work towards doing it. Prof. Mangadi is here, he will tell you, let's do renal transplant. We have the option of doing some other things, or just remaining how we are to manage, or we just move to the next level. Leaders cope with change, they set direction, they align people to participate in that new direction and motivate people. And there are different levels of leadership. in the health sector as it affects the physician. We have the low level, that is the day-to-day management. Any physician is a leader. You manage your patient. We have the middle level as chief residents, consultants, heads of departments. People take these things with not the seriousness it deserves, but chief resident is a very, very important post. He practically runs the department. He's like the deputy HOD. So any person that has been given chief resident and he does that well, you know that most likely this person may be able to also be a good leader. And then we have top level that involves heads of parastatals, CMDs, provosts, in fact, commissioners, ministers. The good thing, what is happening now over the last 2-3 years, even federal PAMSECs, all the promotions you have been seeing over the last 2-3 years, see PAMSECs coming, you see like 30 to 40% of them will be doctors. The recent one just that came out last week, you have Dr. Kana, Dr. Ngozi, before then Moribod, others, what's his name, Belgore and others. So we have quite a number of, in fact, even the current head of service is a medical doctor. So we have different levels, low level, middle level, and even the top level that can go everywhere. And as Prof. Panti said at the beginning, every person is needed because you have a holistic approach of everything and you can be fair to everyone. The resources to be managed, we all know them, the manpower, the money, the other drugs and consumables. Now the manpower, this is the most important aspect of health care system. That is the most important and the most complex one to manage. And therefore appropriate skills in human relations, intra-professional relationships and conflict management is really very much needed, a leadership skill. Being a physician alone puts you at a disadvantage. The moment you are in position of authority as a physician, people will not give you that benefit of the doubt. Whatever you do will be interpreted or misinterpreted. So it makes it very difficult for you. So you need to work extra hard to make things work. I was privileged to be with a federal PAMSEC that was appointed, and I said, I pray you should be posted to Ministry of Health. And he said his prayer is that he should be posted anywhere but health. The moment a physician is posted to health, that's the beginning of crisis. No person will believe he will be fair to everyone. So you must know how to manage everyone. Money is another thing that you must know how to manage, especially in a situation whereby you have dwindling funds. The ability to make wise decisions about money is one of the attributes of a good leader. This cost-effective treatment options for patients, we need to improvise sometimes and reducing overall wastages. Materials also, the supplies, drugs and others, we need to manage them very well. Time is so important. Time is money. Proper time management is essential for high quality healthcare delivery. That is something very, very important. Patients may experience less waiting time in a situation whereby we have patients coming from morning to night just waiting to see a physician. It's a big problem to all of us. We need to improvise a way that you give somebody time-bound appointment. If he's going to come, if you know you may see him by 3, let him come by 2. But from early morning to evening, it's quite wasteful to everyone and there will be too much fatigue. And the colleagues and other health workers may experience less job-related stress when tasks are done properly. When you go to the theater and you spend 2-3 hours preparing one patient for surgery, you have not even started the surgery, you can imagine what the outcome will be. And you may end up just having 1 or 2 surgical cases per day. So time management is something very important that we should know how to manage efficiently. The roles of doctors as managers or leaders, the normal thing, you need to know how to plan, to implement, and to monitor and evaluate. And then the planning involves setting organizational and team goals. This includes setting objectives. That this is what you want to do at the beginning. You motivate people let's move towards that place. And then you have to implement, because in most instances we have very good policies and visions, but the implementation becomes the problem. And that is why you need to build a team that will implement those goals. That is very important. The process that ensures the activities are carried effectively, efficiently, and responsibly. And you need excellent communication skill. The implementation of the vision is very, very important, not the ideas alone. And of course, monitoring and evaluation. The assessment of the progress made as compared with earlier plans and how well objectives have been achieved. Now, what are the attributes of good leader? We need to mention this so that people should be encouraged to go into leadership, but they should know what are the things needed. And one of them is personal mastery. You need to acquire knowledge, personal learning. You must learn. You must know when you have deficiencies. You must learn. And when you want to learn, we are not talking of learning ENT, pediatrics, medicine. That we believe you must have known to certain extent, and you should also keep learning that. But more importantly, other aspects of knowledge must be acquired. ICT is now mandatory for everyone. You cannot move into leadership or management without ICT. Another very important knowledge includes things like public service rules. These things should be taught, but very importantly, any leader must acquire these. Financial regulations, scheme of service. These things must be known. If not, you will either go and take an action that may backfire, or you'll be ridiculed, or you allow things to be going wrongly. So every person will look forward to the time when the CME will be on either public service rule or scheme of, or whatever it is, so that we all learn that if you do this, this is misconduct, this is gross misconduct, punishable by what public service rule 30331 or something like that. We should know the basic things, how people enter service, how they live. All these things are very important. A good leader should also have this system thinking. It refers to the ability to see interrelationships among processes, different activities, professional groups. You have to think of the system as a whole, and then mental modeling. This includes visualizing your goals and what you need to achieve. You need to have a vision, and you need to see how you can achieve that. You must be very innovative. Another very attribute of a good leader is team building. You can encourage people to get to their potentials, but you must build also a system. You must build a team that should deliver your goal. It's not every person that may be part of it, but you must develop the capacity of the team and let them have the same vision with you. Then you must also have shared vision. This quality helps to obtain the commitment of others towards the vision aimed at solving certain challenge. A shared vision is one that other team members can adopt and literally own. You make them believe you can do this, and they own it, and every person works towards that. We have different types of leadership. We have the transformational. Somebody comes with his vision, ideas, and then he tries to motivate others. Let's move towards that. You have situational, the ones that they look at the situation and they look at what best fits the system. That is another form of leadership. This can be achieved by directing, coaching, supporting, and delegating in response to the followers' readiness. Another is the servant leadership, the one that Babaji Green's governor, servant leader. Yes. The influence of the leader comes from the need to serve. So you synthesize ideas, you listen, you accept stewardship and other active development from the potential. So you gather all these things and then you implement what they want. That is the servant leadership. In general, we need combination of all this to have good leadership. You come with some transformational ideas, You look at the situation, and then you also listen to the servants. So the servant leadership is also important, and somebody should look at his strength and go through that. And we can develop good leaders through mentoring. When we say mentoring, we don't refer to you mentor somebody to be like you. No, you mentor somebody to bring out the best in him. He can be better than you, or you know what are his potentials, and you mentor him to reach those potentials. So you invest your time, energy, personal know-how in somebody to bring the best out of that person, but not for him to be like you. You can coach somebody, that is specific. You coach him for something, let him learn how to do this leadership activity. And another one is practice. You keep on by observation, by giving somebody some responsibility. And networking. Networking is another very important aspect of leadership. It creates interdependence and often mutually beneficial to the relationship. It can be peer networking amongst your peer, or you network with your senior leaders. And then sometimes people even go to other places to learn the leadership. They go to other places, either secondment, part-time, entirely new jobs, so as to learn this leadership. Now, what are the challenges of doctors? What are the challenges that doctors may face as managers of resources? As I've said at the beginning, you being a doctor in Nigerian context in leadership is already a challenge, because no person gives you the benefit of the doubt. Whatever you do may be misinterpreted. But then we have lack of adequate training of doctors on health management, and we feel this is where we can improve. Health management should be included in larger portion in the undergraduate and the postgraduate course, and it should be mandatory. Even on our CMEs, public service rules are virtually non-existent. No person knows about these things, and the ICT and others. So that is one challenge. Another very important challenge is our tight work schedule and work pressures that could constitute a challenge to the doctor who manages resources. All of us are quite busy from beginning to the end. So if you come in the morning, you already have your clinical schedule. So it's very, very difficult for you now to be in leadership. You have to, one must suffer. One will definitely suffer. Along that line also, the busy schedule of caring for patients. All of us care very much for our patients, and therefore you have little time for dispensing managerial responsibility. That is a big challenge. If you really want to be a clinician and a good leader, it's a serious challenge to all of us. You be in your office, you really want to go and see a patient, and you have been following up with that patient, then you have a meeting by 10 that you don't know when the meeting will finish. So it's a serious challenge to us, time management and a busy schedule. Another problem is intra-professional wrangling, which is a major challenge to doctors who manage resources. Whatever you do is generally misinterpreted. And in a health system that government keeps on bringing different government keeps on bringing a lot of policies on daily basis. You'll be seated today, you find one policy, and another day. So whatever vision you have, if you are working in the government institution, it's actually very difficult for you to interpret. You have a very simple solution and every person knows it. A simple example that you have lack of drugs in the hospital, and the easiest thing is just engage somebody and do a PPP. It's very easy. Get somebody, let him bring, you manage together. But the government policy is so difficult to do that PPP. So difficult. You get some approvals, you move to the ministry, you have to move to ICRC, and everywhere you go, the document takes months and sometimes years for this thing. And for some reasons, the unions also may prevent that. And you must get approval to do this. It's so simple and easy. If you you don't have a CT scan, get somebody to bring your CT scan and you work together. So there are a lot of government policies, and today a policy will come that affects professional rivalry. So on daily basis, you keep on getting things that make it very difficult for you to manage the institution. Another one is lack of funding. It affects the system seriously. In a situation whereby you have to generate money to run the institution, government policy is that you should send junior workers away, cleaners and security, but you are not given one single kobo to pay them salary. So how do you run the institution? Now you have begged, why don't they bring back those people to a payroll? Employ them as permanent workers. If that will solve the problem, they say no. The idea of outsourcing, sending them away, is a very nice one, because when you get contract staff, you get efficiency, they work, no strike, nothing. You can be rest assured your institution will always be clean, it will be secured. But nothing is being paid. So policies keep on changing on daily basis, and the resources are so limited. Our electricity bill now is 20 million. How do you pay it? From the revolving funds? So dwindling resources and even the capital is not adequate. What we know is that the African Union 2001 Abuja Summit recommended 15% allocation, but to the best of our ability, I think what we receive is less than 6%. So it's actually very difficult to work when the resources are not adequate. These are the challenges being faced in the health sector as it affects the leadership. Now, what are the recommendations and the conclusion? That good medical leadership is key to building high quality healthcare. This every person knows. In the development of medical careers, the teaching of leadership has traditionally not equaled that of technical and academic competence. What we deal with is we go for PND, orthopnea, hernia, and other things. But we should also be taught adequately about health resource management. That is very important. And there is need to start leadership education for doctors early, and it should continue. It's not just after your graduation you are done. It should be part of our CMEs, and it should start right from medical school. It will be part of our curriculum. Because we have said it, it's not only people in top leadership. Any doctor is a leader. So when you do not have those adequate leadership skills, it becomes a problem in management of patients. Okay, so we have already mentioned that being a physician requires not only management and leadership, but it also requires the need to transfer competencies to communication and critical thinking. Additionally, healthcare is changing rapidly, and it is critical for physicians to develop leadership skills to help guide this change on daily basis. Either you have a new disease or new technology on how to manage patients. So there is need for us to acquire more skills in the management. And to meet this need, well-designed and well-evaluated leadership curricula are needed. I thank you very much for listening to our presentation. Thank you.